Hi, everyone. Welcome to the CAPE and CAM information session tonight with Covered California. So excited to see you all here tonight and excited to kick things off. So just so you all know, my name is Grace Cow. I am the Chief of Staff at CAPE, which stands for Coalition of Asian Pacifics in Entertainment. CAPE is a nonprofit organization creating opportunities for Asian and Pacific Islanders behind and in front of the camera. At CAPE, I steer strategy and operations for programs that connect, educate, and empower API artists and leaders in entertainment and media, with a commitment to making CAPE's programs more accessible, inclusive, and impactful for creatives at every stage of their careers. You can learn more about our work at CapeUSA or capeusa.org or follow us at CapeUSA on social media. And I want to talk a little bit briefly about why we're here tonight. Essentially, in our work, we talk a lot with a lot of folks who are entertainment professionals, they work in the industry, freelancers, people who have maybe fluctuating income, gig workers. And as we were chatting with folks, we know it's a tough time in the industry, and we always want to know what else we can do as an organization to support people who are sort of navigating a lot of changing tides. And as we talked with folks, it was revealed that a lot of people don't know, certain things about perhaps how to get or maintain healthcare coverage, things that are really important for a living. So we wanted to partner with Covered California, with our friends at CAM to really kind of bring people together and make a safe space for people to ask those questions. I'm really excited to hand it over to my co-moderator, Sapana Sakya, the Talent Development and Special Projects Director at CAM, the Center for Asian American Media.
Thank you so much, Grace. Hi, everyone. Thank you so much for joining us for this really important discussion. As Grace said, I'm the Talent Development and Special Projects Director at the Center for Asian American Media. I've had many roles at the organization, from producer to fund manager, and now I work in artist development, where I primarily work with film and media makers on developing their projects and their careers. For those of you who might not know, CAM is a national media arts nonprofit based in San Francisco. We're dedicated to storytelling that illuminates the experiences of our diverse Asian American communities. We invest in Asian American stories by catalyzing these ideas, building pathways, and developing makers to present works through mass media and public programming. We support authentic, independent Asian American stories from inception to presentation with a focus on untold and emerging narratives. You can feel free to find out more about our organization at cammedia.org. And as Grace mentioned, I'm super excited about this panel because it's such a crucial conversation for so many in the film and media industry that we support. Many folks work as independents on their own projects while also doing contract or gig work to sustain themselves. So this means that many folks don't have a stable employer to rely on for health insurance, for example. So it's my privilege to introduce our esteemed speakers for today's session. I'd love to welcome Jessica Altman. Jessica is the Executive Director at Covered California, and also Jasmine Hung, who's the Individual Health Department Manager at KCAL Insurance. And thank you both so much for joining us. Just a quick overview for today's session. We have about 50 minutes for this discussion, and we're going to start off with the first 30 minutes with Jessica and Jasmine, 15 minutes each, to provide some high-level information and overview for our audience who might not be familiar with Covered California and the do's and don'ts for enrollment, for example. And now I'd like to pass the floor to Jessica. Please introduce yourself and feel free to go into your talking points.
Wonderful. And hopefully someone will pull up my slides while we do that. First, I want to thank Grace and thank Sapna for bringing us here, for creating this space for us to share what is hopefully really valuable information for all of you. And thank you to Jasmine, who is one of our incredible enrollment partners. I'll talk more about later, who's going to really help you get into the nitty and gritty of how some of this works. First and foremost, what is Covered California? I always like to start with what we are not. We are not a health insurance company. We are not a health insurance agency, and we are not in this for profit. We are an independent state agency. We do this work for Californians. Our mission is to connect Californians to coverage, to reduce the rate of uninsured Californians, and to ensure that the healthcare, as best we can, that people are accessing is affordable, accessible, high quality, and equitable. And so we really, everything we do is in service of Californians, and in particular, Californians that need to look to Covered California to meet their health insurance needs and really their need to access healthcare, which we fundamentally believe every Californian deserves. So heading into my slides, I just wanted to start with a little bit of history of how we got here and why we are who we are. Many of you have, I'm sure, probably all of you heard of the Affordable Care Act. Many people call it Obamacare, which was a law passed way back now in 2010, looking to fundamentally change the way that health insurance was delivered in our country. And in particular, recognizing that when you have a fragmented system like ours, where many, actually the majority of Americans get, or the largest portion of Americans get their coverage from an employer who's offering stable benefits, and then you have programs like Medicare and Medicaid that serve certain populations, that some people were falling through the cracks. And so the ACA really aimed not just to fill those cracks, but also to pair that with steps to make healthcare more affordable and to ensure core protection. So people with pre-existing conditions aren't discriminated against, and other practices that insurance companies had that could limit coverage, right, are no longer allowed. And so it really fundamentally reshaped our system. The first way they did that is by expanding Medicaid for people below a certain income, but then created marketplaces, health insurance marketplaces, of which Covered California is the ACA health insurance marketplace serving California. We opened our doors for coverage that began in 2014. And so for over a decade, we have been working to reach people, connect them with coverage, reduce the uninsured, and make healthcare better. I think the thing to know about us, right? We are a marketplace. I'll talk more about this, but basically we help you shop and compare from name brand health insurance plans that are sold where you live and give you a variety of options. And then we also are the only place where people can go to receive financial assistance. They come in the form of tax credits to help bring the cost of coverage within reach. I want to mention there's been something on the news a lot, if you track things closely, about how generous those tax credits will be as we head into 2026. And that is a bit of an open question. But we will have tax credits in 2026. What's in question was enhancements that made those tax credits more generous. But as we head into 2026, the majority of people we cover will still be eligible for tax credits that lower the cost of coverage, which means if you're someone who doesn't have access to employer coverage or one of the other public programs, we are still the most affordable place for you to access comprehensive health insurance coverage. And we'll talk more about how those tax credits and eligibility work throughout today. Next slide, please. So who are we here for, right? We're really here for you. And what I mean by that is, as I talked about before, we have a lot of people who get coverage from an employer, but there are a whole lot of people in this country and in this state who don't have the privilege of working in a way that they have a stable employer offering them stable benefits and a health insurance plan. And so Covered California is where people can have that economic freedom to work how they want to work, where they want to work, when they want to work, and still have access to affordable coverage. We cover just under 2 million Californians today, but sometimes people come and go and need us for a period of time. So at some point since we opened our doors, we've covered about 1 in 6 Californians. A quarter of our enrollees are sole proprietors, around 500,000 running their own business, but we are here for the gig economy workers, for part-time workers, 1099 workers, and we know there are a lot of people in the entertainment industry, creatives, freelancers, who are working in these ways, where you are doing amazing, wonderful, beautiful work that doesn't necessarily come with an employer saying, here's your health insurance plan for the year of 2026. And so that's what I mean when I say Covered California is here for you, or at least many people in your industry who may need coverage like this. Next slide. So open enrollment. If you've ever had employer coverage, this is probably, or helped someone with Medicare, maybe you're even on Medicare, you're familiar with this terminology. This is the time of year when anyone who needs health insurance can come in and enroll for the coming year. You can have just lost coverage, or you could have been uninsured for years, and it doesn't matter. You can enroll during open enrollment, and now is your window. We open for open enrollment on November 1st. Open enrollment goes until the very end of January, midnight on or 11:59 p.m. on January 31st. But if you want coverage for all of 2026, you want your plan to begin on January 1st, you do need to enroll by the end of December. And so I'm looking at my clock. It's December 11th. There are holidays, there's shopping, there's celebrations, there's a lot to do. So it's good to be thinking about this now if you haven't looked into it, and take the time to explore your options if you're someone that is looking for coverage. Next slide. Before we go here, I honestly can't remember if I have a slide on this. I want to say that you can enroll outside of open enrollment in certain circumstances. So it's what's called special enrollment. And if you have a big change in your life, I think most commonly, if you lose health insurance from another source, you cycle off of union coverage, you cycle off of a job that was providing you coverage. At any point, if you lose coverage, or if you move to California or from one part of California to another, those are both qualifying life events is the formal term. So is divorce, marriage, having a baby, where you can get coverage at other times. So I do want to highlight open enrollment is when we don't need to know why you're coming. Other times of year, you can get in any of those circumstances that are common reasons why people change their health insurance or need health insurance. Okay. So I mentioned this before, self-employed small business owners. Half of marketplace enrollees in this country are small business affiliated. They are sole proprietors, small business owners, or employees of small businesses that aren't able to offer coverage. 1 in 4 of our enrollees are self-employed, and 90% of those receive financial help, meaning that they earn less than about 90% of self-employed enrollees earn less than about $62,000 annually for an individual. That is a qualifying income for tax credits on Covered California and on the marketplace. Next slide. So if you get to Covered California, I talked about us being a marketplace. You're going to see the name brand health plans that you're familiar with: Anthem, Blue Shield, Kaiser. If you're in a region like LA Care, right? These are the plans that we offer. And then we help you understand how the generosity of plan looks like using what we call meta levels. So you have a platinum plan, which, like it sounds, is fancier than a bronze plan, which is our least generous plan. The way to think about this is how much money do you want to spend upfront monthly through that premium payment you pay each month, whether you use healthcare or not, and how much would you want to have to pay if you need healthcare services through deductibles, copays, and things like that. So on the one side, you have the bronze plan, which has the lowest monthly cost. It does have, like every plan on Covered California, free preventive healthcare services and free primary care visits included. But when you need things beyond that, specialty care, if you need to go to the hospital for something, you will have a higher deductible, higher copays. On the other side, you have the platinum plan, costs the most per month, but has no deductible at all. Same with gold, and lower cost sharing across the board. The monthly tax credit you're eligible for is benchmarked off the cost of that silver plan. So we consider that sort of the core base plan on Covered California, it is where most of our enrollees go for coverage. And many people in that silver plan, depending on your income, also receive extra help with deductibles and out-of-pocket costs. I'm going to go on mute for 1 second for this cough. I apologize. I left my water in the other room. All right, next slide, please. Next slide, please. I'm actually going to hand the floor over. Perfect. Of course, I should have done it before I had my coughing fit. But one of the things we do before I hand it over is really try to support people in navigating the enrollment process in any way that we can and make it as easy as possible. This can be daunting. It can be complicated. Healthcare in this country is complicated. And so we want you to do that however is best for you. You can do the entire process online at coveredca.com. You can call us and speak to one of our incredible service center representatives, but we also have over 14,000 enrollment partners across the state. These are insurance agents, they're community-based organizations, they're in every nook and cranny of California, and they speak over 40 languages for anyone for whom English is not your primary language. Our enrollment partners are at the ready. All of their help comes at no cost to the consumer. If you would like someone really to sit down and walk you through that. So Jasmine, who I'm going to introduce, is one of those incredible enrollment partners with CAAM Insurance, and she is going to explain a little bit more about the nuts and bolts of Covered California and what you might want to think about. So with that, I think Jasmine, I'm gonna hand it over to you and thank you for all you're doing this open enrollment to connect Californians to coverage.
Okay, thank you so much, Jessica. Hi everyone. My name is Jasmine, representing CAAM Insurance Agency. So CAAM Insurance Agency, we're like a bilingual agency dedicated to help individuals and families to find the right health insurance coverage. And like Jessica earlier, she introduced how Covered California works. And so for our role, we are a certified agent under Covered California. And Jessica also mentioned about the golden period for the open enrollment for individual, starting from November 1st to next year, end of January. So this 90 days, it's a golden period for you to reshop around your health insurance. And she mentioned about the EPTC that's ending end of this year. That's why bringing up the premium so high. So for this year, the year 2026, it's kind of like a huge rate increase for a lot of the high income level people. But for low income friend, that we still see a lot of subsidies that are able to help out the family to have a coverage. Yeah, and to clarify, as an insurance agency, we are trying to give all the clients a guideline to how to apply for the coverage. Let's go to the next slide. And I also want to clarify, a lot of the people, when I chat with them during the open enrollment shopping around, they might think that finding a huge agency, the pricing will be super more than they go on to Cover California, but the premium, it's standardized. So if you shop through Cover California or shop through any of the agent that you give us the 3 magic number, as on the upper right that you're able to see how to quote for the health insurance. We will need your age, your home zip code, and your household member on the tax file, and also your estimated income. So Jessica shared us about the open enrollment period, that 90 days golden period. So what happened is for the special enrollment that she also mentioned a little bit about how to qualify. If during of the year that you are qualified for any life event, then that's what you can get coverage from. Yeah, so you guys can screenshot this that during the 2026, in case that there's any qualified event that you are qualified, then you don't have to worry that you are not able to get insurance. So during today's sharing, you can, if you are not sure how to get a quote or anything like that, on the upper, that's the 3 magic number that we will need. Insurance premium, it's definitely based on your age and your home zip code, that each insurance carrier that will calculate out how much premium that you will need to pay. But with Cover California, when you give us the estimate income, then that's how Cover California will shows you, hey, how much subsidy that you will qualify for that. Okay, let's go to the next slide. I know a lot of the people today that some of you guys are 1099 workers or your income. So for Cover California, it gives us, when you apply for it, you can do an estimate income for the 2026. Some of the clients that they will panic, they are not sure how much money that they need to put down for their estimate income. Sometimes they will use their current file text. For example, right at this moment, you are able to bring 2024 tax filing numbers. On the 1040 form, on the very bottom, there will be an adjustable gross income. You can put that as a reference. So I understand that year 2026, it's not over yet. So when you put an estimate annual income, it will give you at least like an estimate of subsidy that you will get. But at the end of 2026, when you are filing the tax in 27 for that 26, if your income is a little bit higher, you make more than the extra subsidy that you get, you will during your tax filing, you will pay it back. So it's not some of the people think that it's really hard with the numbers, but try to talk to the insurance agent or Cover California representative and to work it out. And that's how we are here to help for. Let's go to the next slide. So like Jessica mentioned, Cover California represent for the subsidy side, and a lot of the insurance carrier, it's under Cover California that you're able to pick. Depends on the county that you're living at. For example, the LA care that she mentioned, it will be only under LA County. And you see the IEHP, it will be under San Bernardino County. And thanks a lot for CAPE for getting this together for today's webinar. I understand that maybe a lot of the attendees are from NorCal. So from NorthCal, a lot of people will definitely pick Kaiser. I think if you are running around North or NorCal or SoCal, a lot of time people will pick Kaiser because Kaiser is everywhere. But it also depends on people's needs and wants. And I believe Jessica mentioned about the silver plan. The silver plan, if your income qualifies, here on the slide on the right, you can see the CSR. That's the cost sharing reduction. So not only you're able to find some help on the premium subsidy, if you're qualified, your income qualifies it, then your silver plan on the plan benefit, you will get less copay. You pay less on the doctor visit, on the emergency, on the hospitalizations, even for the out-of-pocket max. So each person has a different situation. We will definitely suggest you to talk to one of the representative to work it out, see which plan that you're fitted in and which insurance carrier it's better for you. Okay, let's go to the next slide. And on the insurance, after you pick any of the plan, keep in mind that because Obama healthcare reform, it's trying to give us preventative. So every plans that you applied for, you will have annual checkup free. As long as the doctor submitted as a preventative care, then everything is covered. And for all the mental or any additional benefit, all the plan will cover drugs for sure. And on the back of your ID card, it will have the 1-800 number that you can call for the mental health services. And so for any of the benefit and usage tip, some of the insurance carrier will give like an incentive for going to have an annual physical, or they will have some additional benefit. Yeah, so definitely we will try to help out to see who qualify for each of the plan that they're in. And also for the doctor side, some of the people that they have a specific doctor that they want to see, this is also important because each year the doctor network might change a little bit, and that's how and why people need to reshop around during the open enrollment period. Maybe the doctor that you want, it's only under PPO plans, or the doctor dropped the contract, and what other options that you're able to get. Okay, let's go to the next slide, please. Yeah, so thanks a lot for everyone's time to listen to our webinar. On the covercalifornia.com, you are able to find enrollment help. You can find through local if you're in NorCal, and since KCal, we're in SoCal, we can help NorCal clients through email or through phone call. As a technology, we're able to do the DocuSign. We can help over the phone as you need it. But if you need to find any local agency, you can go onto the covercalifornia.com and then find the enrollment help. It will give you the nearest zip code that any certified agent is able to support you. And for Cover California slogan, it's for the love of California. And for KCal, we were trying to always be there for you. So this is our information. You can screenshot and make sure that the 90 days golden period for the open enrollment, try to contact us as soon as possible to make sure that you have the right plan and you pay what you are affordable for your health insurance for year 2026. Thank you.
Hi. So I wanted to jump into the Q&A section. And so I think for us, one of the questions we got, our first question is for Jessica. Essentially, if a project requires someone to move cities or counties, how does that affect their coverage or subsidy eligibility?
Yeah, and it's a great question. And I talked through this a little earlier, but as a reminder, you can get coverage in or outside of open enrollment in a number of circumstances through what we call special enrollment. And one of those is moving. Because if you move from Southern California to Northern California, or the Bay Area to Sacramento, or LA to San Diego, that's a whole different set of doctors that you're going to want to see, and you may need a different health plan or want a different health plan to come with that. So moving from one region of California to another, which you may have to do for work, and that may change your health insurance needs, especially in this industry, is a qualifying life event. And that can be either you are not on Covered California, you move and you want to enroll in Covered California, or it can be you are enrolled in Covered California, but you want to get a different plan that reflects the region that you have moved to. So you can do either of those things using that qualifying life event.
Great.
Yeah, and thank you, Jessica. And I have I guess a slightly different angle question for Jasmine. If somebody loses maybe an employer coverage or a union coverage between productions, how quickly might someone be able to get covered through special enrollment?
Okay, that's a very great question because for the last month, I received a lot of new phone calls that they're shopping around because they got terminated from their employer. And they have the option of enrolling COBRA. So when you are leaving from an employer, they will end your coverage at the end of your termination month. And you have 60 days. Within that 60 days, you can think of enrolling the COBRA. Or you can apply with Cover California. But since right now it's during open enrollment period, so we don't need to have that COBRA letter. But what happens if you got terminated in next year, March? Then, for example, if my termination COBRA is March 1st, then within that 60 days, you have to find some agent to enroll you for the Cover California. or you will need to enroll the COBRA. Otherwise, you don't have any coverage. So that's 60 days rules. 3/1 terminated, then before end of April that you need to sign up for the insurance. Otherwise, for the whole year, you won't have insurance.
Thank you. Thank you, Jasmine. I have a question here for Jessica, which is, related to folks who often juggle multiple, so a lot of creatives, they juggle multiple jobs, may have multiple 1099s or W-2s coming their way. How should they combine or report their income on their application?
Yeah, and if I may, I'm actually going to ask Jasmine to answer that one because I think our enrollers will be more familiar with the nuances of the different income filing. So, Jasmine, can I ask you to take that one?
Yeah, for the 1099 people, that we do, because for Cover California, when we submit the application and with the income, if it's a little bit different than their previous tax income, then it will ask them what type of the job that they're into it. Then we are able to continue to help this client to enroll it. I think it's not too hard, but some of the people that they will get panic. So as long as you're able to give us your current how much that you're making, even for the bank statement or anything like that, we can fill out that form, the income attestation form, to submit along with your application.
Thank you, Jasmine. Yeah, I mean, I feel like a lot of the folks that work in entertainment, in media arts, different things will happen, right? So this is a question for Jessica. I understand you talked about certain circumstances for special enrollment. But the question we have here is, here are some entertainment specific situations, and they'd like to know whether you think they might qualify for special enrollment, like, for example, contract termination or a show being canceled, or relocating for a project.
Yeah, so these are really great. So we talked about relocating, yes. And then the other one is, of course, if you lose coverage in any circumstance. So that can be a contract ended, a show got canceled, you were getting coverage either through that in some way or through a union connected to that, and you no longer have access to that. That is always a qualifying life event. And Jasmine talked through some of the details of how you sort of do that. But anytime you lose insurance from another source, you can come to Covered California. Another example of that, if you're on Medi-Cal and you get another contract and your income goes up and you're no longer eligible for Medi-Cal, that's also a qualifying life event for Covered California. So generally speaking, any change in your coverage or any significant change in your income or anytime you move, those are all circumstances where you can look to Covered California to come in any time of the year. And then again, during the 3 months of the year when open enrollment, you don't need a reason at all.
Amazing. Thank you, Jessica. I think as we had talked about, there's so many people with different circumstances and how they work. So I wanted to direct this question to Jasmine. Someone asked, I work both in California and out of state. How does that affect their eligibility?
Um, for people work out of state, for example, if they apply coverage through Cover California, first they have to be a California resident, and they file tax in California in order to get qualify for the subsidy. But if I travel a lot to out of states with the California insurance for the individual, if I'm traveling to any other states, it will only cover for the emergency only. For long run, a visiting doctor or getting medication, it will be not covered. But at least for emergency, when I travel to work out of states, then this is covered.
That's really good to know. Here's another question, and this one is for you, Jessica. Um, Somebody asks, what if they take on a one-time sort of higher income job? does that mean they might lose their coverage or yeah, how would they continue to be qualified, I guess?
Yeah, that's a really good question. I think where to start is we don't have a cap on income for who can get coverage on Covered California. So, in no circumstance are we going to say, oh, your income is too high, you can no longer get health insurance from us. Though that may happen in Medi-Cal, as I just talked about, because there is an income at which you make more than makes you eligible for Medi-Cal. So that's first. You're not going to lose your health insurance. Jasmine talked a little bit earlier about how you think about projecting your income for the coming year when you're enrolled, but then it trues up at tax time. So basically, you're telling us, and we're operating on behalf of the federal government who pays for your tax credits, this is what your income is. And the way the tax credit works is the lower your income, the more you get, the higher your income, the less you get. If your income ends up differently at the end of the year, that will get trued up on your tax time. As Jasmine said earlier, if your income ends up higher, that means we were giving you too much tax credit throughout the year and you will have to pay that back. But the reverse is also true. If your income ends up being lower, you'll get money back at tax time because they actually owed you too much tax credit. One thing I really encourage people to do, because we really want to avoid surprises at tax time, is you can always update your income in the middle of the year. Again, you can stay covered and keep your plan, but you can adjust your tax credit to make sure that reflects a significant change in your income. And so whether or not that means you will or not get financial assistance really depends on where you thought your income was going to be and where your income ended up. At the end of the day, where your income ended up will determine how much tax credit you were eligible for in that year. And if you didn't get it already, you'll get it when you file your taxes. So I think that's the best way of putting it. Again, we really want to help people avoid those tax time surprises. Maybe we like it when we get money back at tax time. Some people do that, but the other kind of surprise we don't want. So do make sure to work to update your income or work with your agent or enrollment partner. They will help you do that so that you're paying the right amount, getting the right amount of tax credit throughout the year.
It's a really good point, Jessica. I think I recall, I think getting a promote or a raise partway through a year and then getting a little bit of a surprise at tax time when they did that true up. So definitely something that's good is to keep that income updated on the Covered California website.
You
Um,
can actually also, if you have a really variable income, we have a way where at the beginning of the year, we'll say, we think you're eligible for $300 of tax credit per month. And you can say, you know what, I hear you, but what if my income's higher and please only give me 250? And you can actually adjust that up front. If you were right and you deserve 300, guess what? You'll get that money back at tax time, but you will have sort of taken an action to prevent paying back money at tax time. So that is an option that you can also do if you're worried about variable income and you'd rather pay a little more upfront and avoid an unpleasant surprise and maybe plan for a pleasant surprise at tax time.
that's amazing. Yeah, that's great to know. I didn't know you could also kind of like, do that proactively and get lower kind of tax credit. I have a question for Jasmine, which is what happens if I enroll in a plan and I later realize that my doctor isn't in network?
Okay. Yeah, before I mention answer your question, I want to congrats about your raise. So a lot of times that uh, my client that sold the stock and gained a lot of money, that's where they need to pay the subsidy back. Yeah, so it's a good news. Yeah, so it's a good promote, right? Okay, yeah. So what happened if after I enroll and I realize my doctor is not in the network? So if it's still during open enrollment, you are able to change it. We do have some client that they already decided their effective day 1/1, they would like to go with certain insurance carrier. But when they go see doctor, trying to go see doctor in January to make appointment, and they realize that, hey, this doctor is no longer in network and they want to change it, you are still able to change it at the end of January 31st. Okay. So end of January 1st, before, if you change that, then effective date will be February 1st. If you already past the open enrollment period, then what we can do is we are able to find another doctor. Of course, there's many doctors that are on the insurance list nearby you that you're able to see how it can work it out. So that's why we put the open enrollment period as the golden 90 days period that you shop early and trying to find out to make sure that your doctor, make sure the right plan, the right doctor, the right hospital, and the affordable right subsidies for your family. Yeah.
Thank you so much. I mean, there's so many great questions. And somebody asked, maybe for Jessica, if they, for example, think of other questions after this webinar is over, who might be the best person or organization to contact?
So you can certainly look to Covered California. Again, you can visit us at coveredca.com. You can live chat us there, which that is my favorite way to get help and answer questions. I'd much rather type than talk to a human, which says a lot about me and society, but here we are. So you can do that. You can also call us and really get a human being on the phone from our call center at 1-800-300-1506. And then we have this incredible tool on that same coveredca.com called Find Local Help. And that's where you can find people like Jasmine. You can search by where you live, what your zip code is, and find someone local. You can also search by preferred language if you're looking for support in a language other than English. And that's where if you want someone to be like, here's my situation and my 4 1099s and how do I do this, that's where you should go. If you really want that type of one-on-one support, have one of our incredible enrollment partners help you with that work.
Thank you. I had a question. I was looking at the Q&A, and this one is probably for Jasmine. But essentially, if you enroll in insurance through Covered California for next year, but then you get a job in 2026 that provides health insurance, can you then co cancel your Covered California coverage?
Yes. First, we will congrats that this person found a job for 2026 because I heard that it's really hard to getting job lately, huh? So once if you got the job and then after the probation, your employer will start giving you the option of enrolling the group health insurance. So definitely you will enroll the group health insurance, and um, you can cancel it first of the following month. You may cancel your Cover California coverage first of the following month. Some of the people that it's very cute, they thought that they're bundled for the whole year, they're tied up for the whole year, but it's not. You get the flexibility as long as making sure that the employer coverage is affected, then we will help to cancel it.
There's another question here for Jessica. You might have touched on it earlier. Somebody asked for a lot of API creatives or anyone who needs language support. Is there a particular in-language enrollment number or site they can turn to?
Yeah, you can turn to those same places, but just to highlight, I mean, certainly on our website, you'll find content across the most common and even some less common of the Asian languages that are in California. So certainly Chinese, Vietnamese, Korean, but also Hmong, Tagalog. We have information, educational content, video for you in language. You may, depending on where you get your media, if you're looking to Asian ethnic media sources, you'll see that we are also out there in language. If you call us, we also have in language call center support, again, in the more common languages, but also we do offer language lines. So really any language that you speak, if we don't have someone in-house, though usually we do, we can have translation services provided live when you call. And then, of course, our enrollment partners, I did mention this piece, they speak well over 40 languages with enrollment partners across the state. If there isn't someone local, as Jasmine said, they help over phone, over email, over Zoom in many cases, though usually there is someone in your region who speaks your language. And you can, in that Find Local Help tool, search and say, I want someone near me in the Bay Area who speaks Vietnamese, and we will show you in that tool who's available to you and who's nearby.
Amazing. That's really helpful to know that that's something that's available. I have a final question here. This one is for Jasmine, and essentially, well, how long does the enrollment process typically take from start to finish?
Okay. Yeah, I think it's really I'm very blessed to live in California because we have Cover California. For the love of California, Cover California is putting so much effort for the last 10 years to trying to do any of the upgrades, no matter you go onto the website to getting quote or for the enrollment part. So for nowadays, with the technology, it's getting better and better. Once we submit the enrollment through Cover California, you are able to receive the letter from Cover California about your enrollment. And please keep in mind that Cover California will send your information to the insurance carrier that you select. For example, if you select the Blue Cross as your insurance carrier, then Cover California will send in your information to the insurance carrier. And once the insurance carrier receives that information, then they will mail you out for the ID card, of course. Then that's when you feel safe that, oh, I have a coverage. But also, I would like to share you guys for some of the people that don't know, a lot of people that they want to pick a plan that's more affordable. So HMO or a PPO, a lot of the people that will pick HMO. So as a HMO member, once your information is in the insurance carrier, but HMO, it's under a medical group. The primary doctor that you select, it's under a medical group, then your insurance carrier will send your information to that medical group. So usually give them about like 7 to 10 business days to update and to upload into the system. So it's not a magic click. Once you submit to Cover California, then everything that your information will be in the insurance carrier side and on the medical group side. And you, when you go see doctor, your doctor is able to verify everything. But we can also help a client to contact insurance carrier to expedite to sending your information to the medical group in this way that you don't get a holdback for your doctor appointments. Yeah, so during this open enrollment period, try to talk to the professional specialist through Cover California's rep or through agent, a certified agent that we're trying to be there to help for you.
Can I just add quickly that Jasmine's such a great overview. If you are someone, you've sat through this whole webinar and you're like, I'm still not sure, how much is this thing going to cost me, right? Which is what I hear from a lot of people. You go to coveredca.com and you click where it says get a quick quote. And if you click where it says get a quick quote, you can enter 5 basic pieces of information about you and your household. Who needs coverage? How old are they? What's your income? What's your zip code? And are you pregnant? I think is the last one. And it takes under a minute. You can, if you want, also say, here are doctors I want to make sure are in my network, or here are drugs I want to make sure are covered. You can also skip those questions. In under 1 minute, it will say, based on the income you told us, here's how much tax credit we think that you're eligible for. Here are the plans where you live, and here's how much they will cost you after that tax credit. And you can just take a quick look. Now, if then you're like, okay, I can do this, you do have to go through the enrollment process, enter more information about yourself, but just to see what's there, it really does take less than a minute or two.
That's an incredible tool. And I see that LJ has dropped it into the chat where you can kind of go on the website and find all of that. As we sort of start to close out for the night, I guess I wanted to give everyone the chance to make some final remarks. Anything you want to say to let our folks tonight know as they, leave tonight from the webinar. I guess we'll start with Jasmine.
Oh, yeah, thanks everyone for the time to join to the webinar, and thanks Kate for organizing this. And I'm very thankful that Jessica is able to share with me a lot of the things. And since she's like the expert of the expert, so definitely all the attendees, I think you guys will gain a lot. And make sure that you contact Cover California for any help. Yeah.
Thank you, Jasmine. And Jessica?
Thank you. I mean, our enrollment partners are the real experts, as you can see. So thank you, Jasmine, for all the great information that you provided. And thank you to Grace and Sapna for hosting this. I think I would just reiterate, right? Like our mission, why we are here is to help you and help you chart your journey to health insurance and healthcare and figure out this complicated system that we have in this country. So we are here for you. We do this for the love of Californians. And I always have to remind, we're in open enrollment. If you need health insurance, now is the time. Do not wait. You have other things to do before the holiday season. Again, with the dates, open enrollment does run until the end of January, but if you want your coverage to start on January 1st and be protected for all of 2026, you do need to enroll by the end of December. So just a few weeks left in that timeline, but don't hesitate to reach out if Covered California can help you on your healthcare journey.
Thank you. Thank you so much for that, Jessica. Super helpful. Sapna?
Yeah, no, I just wanted to say thank you so much, Jessica and Jasmine, and for Covered California and CAPE and IW Group for hosting this really important conversation. It couldn't have come at a better time. I think definitely got the message. Take advantage of the open enrollment period. And also, if not, special enrollment it's sounding more to me like it is fairly flexible, even for entertainment individuals who have, different circumstances from month to month, possibly. So thank you so much, everyone, and thank you, Grace.
Thank you. I'm also really grateful, echoing everyone here, for IW, Kate Cam, and Jessica and Jasmine for being here tonight because there's so much information here. I'm a Covered California member and I enroll. That's how I get covered. I am constantly helping my boyfriend, who is a freelancer, navigate that healthcare. And so a lot of what was said tonight was really, really helpful. And I hope helped demystify a little bit of what could seem like a really confusing and hard to navigate sort of healthcare system. If I may throw one more deadline in there, if you're a writer and you're joining us tonight, the Cape New Writers Fellowship is open for applications and we close applications on December 15th. So my program's head of programs couldn't be here tonight, but she wanted to make sure I kind of threw that note in there since we know we have a couple of creatives here tonight. But other than that, thank you all so much for joining. It's been a really, really wonderful time chatting with everybody.
Happy holidays, everyone.
Happy holidays.
Yes, happy holidays,
Happy
everyone.
holidays.
Thank you.
Thank you.